So what exactly is advanced care planning? Advanced care planning is the process of planning for your future health and personal care if you become ill one day. We are not talking about cough, flu, fever here. We are talking about serious illnesses like stroke, coma, serious dementia, renal failure, and all these illnesses. Right? So advanced care planning is all about putting up a plan, an SOP, to look after your future health if you become very sick one day. And this is an important plan as you can imagine. This is about talking to your loved ones, sharing with them how do you want to be cared for one day if you are very sick, if you are no longer able to take care of yourself, right? Never ever assume that your loved ones know how to look after you, because we're not talking about giving you Panadol, cough syrup, right? All this for minor ailments. We're talking about serious illnesses. There is a high likelihood that they may not know how to look after you, right? So it is important that we share this information. We have a heart-to-heart talk with our loved ones, right? So that they understand that when the time comes, when you are very sick, how exactly do you want to be looked after? And who among your loved ones should look after you? I mean, you have spouse, children, parents, siblings. Who among all these loved ones should be looking after you? So this is what advanced care planning is all about. Having these conversations with your loved ones about how to look after you. And this is nothing new. Many hospitals in the past in Singapore, they have offered these services to mostly their inpatients and terminally ill patients. So traditionally, they only offer these services to their inpatients and terminally ill patients. But in the past few years, Ministry of Health has been actively promoting advanced care planning services to members of the public, like yourself. They realize that it is important for us to plan when we are relatively healthy, when we are relatively okay, than to plan when we are terminally ill. I mean, it makes a lot of sense, right? It is just like financial planning. You don't do financial planning when you have just been diagnosed with a stage 4 cancer. Nobody will insure you, ladies and gentlemen, right? You do financial planning when you are still relatively young, when you are still relatively okay, right? So these are things that you do not procrastinate. These are the things that you put in place as soon as you can. Because as I will explain to you, it is not a difficult thing to do. It is not complicated, and certainly it is not expensive. It is not costly. So there is really no reason why you should not take action. All right. So by having these advanced care planning conversations, it will allow you to share your personal values and beliefs related to advanced care, right, healthcare with your loved ones. And through this process, both of you, you and your loved ones, can explore how your values and beliefs, right, would affect your healthcare preferences during this very difficult medical situation, right? And also to think about who among your loved ones can be your representative one day if you were to become very sick. So these are the key objectives of advanced care planning. This is the broad objective, the broad framework, the broad idea, what ACP is all about. Okay, now let me go into the specific details. What exactly can you do under this advanced care planning framework? The first document is what we call ACP workbook. Now, this advanced care planning workbook is a guidebook to help you through the process of advanced care planning. Now, in this book, it contains more than 50 questions, thought-provoking questions, to help you explore the values and beliefs that will influence your healthcare decisions. So questions such as your pain threshold level, level 1 to 10. Which hospital do you want to go to receive medical treatment? Do you want invasive, non-invasive medical treatment? All these questions will be asked of you, and you will be required to pen down your answers into this workbook. And after that, more importantly, Agency of Integrated Care, which is a statutory board of Ministry of Health, 2 years ago has launched a national database where these workbooks can be registered online, right? So when you become very ill, the healthcare professionals, the doctors, the nurses can actually extract this workbook from the national database. Take into account all your healthcare preferences, right? Because you have written the answers. So they will take into account all your healthcare preferences, work closely with your family members, and formulate a care plan to look after you. So this care plan will actually include all your preferences. Because by that time, you are no longer able to take care of yourself. You probably cannot voice out your preferences. So what the doctors will do is to take into account all your answers in this book and formulate a care plan. And on the other hand, if you have done adequate and proper financial planning, they will provide the financial resources. So on one hand, you have a care plan. On the other hand, you have the financial resources. You put them together. This is how you should be looked after holistically. You cannot have a plan without money because healthcare is not free. Certainly, you cannot have money without a plan. Nobody knows how to use money and look after you. Also pointless, right? Correct or not? So what if your family has the money, but nobody knows how to use the money and look after you? Give you the kind of quality of life, the kind of healthcare that you need. So these two things are important. They have to go hand in hand. Advanced care planning and financial planning. So this is what the workbook is all about. It contains all the nitty-gritty details about your advanced care, right? Which can be registered online onto a national database. Now in Singapore, there are only a few licensed agencies who are authorized to actually do this workbook with you. I think not more than 10. We work with one of them. So they will spend about 2 hours with you and your loved ones and take you through this advanced care planning exercise. All right. So this is not a legal document, right? It can be updated from time to time. So you do not have to worry that, all your preferences, once you have listed them down in this workbook, you cannot change, you cannot update. All the documents that I'm going to share with you today can be changed, can be updated, can be reviewed anytime, as long as you are still alive and you are. All right. So this is the advanced care planning work.